Good afternoon, everyone. Thank you very much for all joining us. Welcome to this ESPNIC webinar about the use of patient diaries. I'm Dr. Julie Menzies. I'm the chair of the Nursing and Allied Health Professionals section of ESPNIC, and I'm moderating this session today. And we've got three great speakers who are all lined up ready to talk to us about patient diaries. Fiona, would you like to start sharing the slides at this point? I'll introduce everybody in a moment. Just to let you know, the session is being recorded and will be available from tomorrow, but only unfortunately for ESPNIC members via the ESPNIC education portal. There will be a short survey at the end, which will come through on a Zoom link. So please feel free to give us some feedback about today's session and how you found it. We're also hoping for some questions in the chat as we go along, but actually Fiona set up a Mentimeter as we start. So she's going to give you the directions on how to load all that up in a moment. So it'd be great if you have your phones to hand so we can load up Mentimeter just to help make this a little bit more interactive and find out about the people on the call. So here today talking about patient diaries and understanding the what, why and how. Our speaker order, we'll start with Fiona Lynch, who is currently a nurse fellow with NHS England, many years experience in the PICU setting and actually about to defend her thesis about the use of patient diaries. We've then got Enza Santoni talking next, who's a paediatric nurse who has finished her PhD last year, also on the subject of patient diaries. And Dr. Gillian Colville, we're really pleased to have her on with us as a psychologist who was working clinically up until last year, but is still research active. So thank you very much. And Fiona, I'll hand over to you.
Hi, thank you. So lovely to be able to speak to all of you. Thank you, Julie. So the what, the why and the how. Well, firstly, it was really important just to say that we have no conflict of interest, any of us to declare, but just to set that out right at the beginning. For those of you not familiar with using Mentimeter, it's a really interactive way of gauging insight from the audience, and particularly when you're presenting virtually. So if you could grab your smartphones and either just click onto just to scan the QR code and it will bring you to a page. Don't worry, the page won't move until we get onto those slides. But also, if you haven't quite managed to get onto Mentimeter, if you just put it into a search engine, and at the top of each of the slides, you will see the code. So you'll be able to then access the questions as we go along. But I just wanted to show you that to start with. So in relation to what we're going to talk about today, we're going to talk about the what. So what are PICU diaries? We're going to then talk about the why. What is the evidence base, if there is an evidence base, around why we were using them? And then the how. And in particular, what are some of the enablers and there's some barriers to using diaries? And as Julie said right at the beginning, we want to ask you some questions too and gather some of your insights into the use of patient diaries. Something's brought you here today, and we'd like to understand a bit more about that. So when we think about the concept of PICU diaries, we need to think about where critical care diaries first started. And you won't be surprised to hear that they began in the adult intensive care setting. And the first really reported use of diaries was back in the 1980s. And for those of us who started nursing in the 1980s, that only feels like yesterday. But they were explored as a low-cost intervention that would help improve the quality of life for patients after critical illness. And some of the qualitative studies have reported that these are really well received both by adult patients and their relatives. And certainly I'll leave Gillian to talk a little bit more about that. For those of you in the UK or those of you with children, you might know about the author called Michael Rosen, who wrote and actually published his patient diary from his experience and time in adult intensive care during COVID. And that's a copy, front cover of his diary there. And a more academic definition of patient diaries, and this is a group called the ICUdiary.org, led by experts in the field, is that the diary is written for the ITU patient during their time of sedation and ventilation. It's written by relatives, nurses, and others. and the patient can read his or her diary afterwards and is more able to understand what happened. And that's a really simplistic view of what the diaries are. And those of us who've used them or have had experience of them actually appreciate this is a really good baseline understanding of diaries, but actually they can morph into being much more than that. And when we think more specifically about PICU diaries, this is a more recent intervention. But when you look at the literature, of which there's not a huge amount, the way a diary, the model that is used is quite variable. They may be in paper, and I've included some photographs of the diaries that I've used in my intensive care in London, and they may be completed by the PICU team and the family. Some are a bit more directive and maybe pre-populated with text and photographs that actually offer some insight and guidance on what the intensive care environment or what equipment is used or what medication may be used. And that they may be directed from the nursing or the healthcare team, but don't really allow the families to populate them as well. So they're given to rather than included with families as well. Also some more semi-structured booklets that maybe morph between, again, information giving, but also allowing family members to contribute. And then although there's not a huge amount of published data around digital or video diaries, we certainly understand from the experience during COVID and the pandemic that these were used more frequently. And it may be that papers will be published around that experience. So I'm going to ask you all a question now, and I wonder if you could tell me, in your PICUs, do you currently use PICU diaries? We'll just give it a few minutes for the questions to load. So I think there's about 40 or 50 of you, 80 of you on the call actually. So we can see for the 16 of you that have responded, and hopefully a few more of you may contribute, but it looks like the majority don't use diaries. I'll leave this just for, I'll give it another 10 seconds, just to give you the opportunity to contribute. So 50% so far do not use diaries. With my very quick maths, I think that means about 35 or 33% do use diaries, and a proportion of you are thinking about it. Okay. So for those of you who are using diaries, and only 7 of you said you were, I wonder if you could pin drop where in the world you are, because I think this will be interesting for us to see. So the UK or England, I think it's the UK, it's big dot. I'm not sure where that is, but certainly Southern Europe. More in the UK. So that looks like that might be Australia. Okay. Well, interesting, these figures mirror what some of the literature is saying, is that it's diaries are still predominantly being seen in Europe, some in North America, and some in the Oceanic and Australia. So it's really interesting. Thank you. So for those of you who do use diaries, this is just a word cloud. I wonder if you could tell us why. Just some of the words you can put in, and you'll probably be able to put in more than one word, but just what are the reasons why you use diaries on your paediatric intensive cares? I'm sure those of you who've maybe used word clouds before, the bigger the word means that maybe 1 or 2 people have said the same things, or more than one person is saying the same things. So we've had 3 responses: long-term patience, memories, process the situation, connecting, parent reflection. Brilliant. Okay, I'm going to move us on. You can keep on building into that. If you don't use diaries, why not? Why are you not using diaries in your PICU? I don't know if you've all gone very quiet or if, oh, two responses, too busy, yeah, understaffed workforce misuse. That's an interesting comment. Lack of knowledge or unknowledgeable, never heard of them before. That's really interesting. Okay, brilliant. Thank you very much, everybody. Let's keep moving forward. So there was one published scoping review of the literature around PICU and neonatal diaries that was published just last year. And what they found in the PICU was that there were only about 11 published papers, of which probably Enza's written 3 of them, and I think I'd written 1 of them, around PICU patient diaries. What they did find is they looked at actually how do we define the diary and what are some of the benefits, and actually some of the words that you've just described in relation to the reasons why you're using them. So they were, as we previously described, they were often seen as personalised notebooks used on a daily basis, offered plain language explanations. We've used English there, but it was plain language explanations by the nurses of what was happening with the child. And some describe them as being seen as parent diaries rather than patient diaries. So an intervention to support the parent and the families. The benefits were, as you described, were around supporting the expression of emotions, facilitating family-centered care. So some of you wrote about connections, helping with mental health well-being and processing of the experiences that the families in particular, but also understanding that may help the child process the experience as well. And then gain information and filling in of gaps in memory. I surveyed with my colleagues Ruth Endicott and Jos the UK, so United Kingdom, including Wales, Scotland and Northern Ireland, and the Republic of Ireland, all of the PICUs in that area, and asked their question, how many of you are using patient diaries? And 43% of the PICUs at that time, and it was 2019 rather, 43% of those units were using diaries, and they used them after gaining consent from the parent or the carer. And actually the parents were the main contributors to the diary. So the nurses primarily would commence them, but then handed them over to the families to continue to write in them. And they were populated with both the written word, but photographs and drawings, and using stickers and colourful ways of being able to explain to the child what may have happened. And they were offered as a way as filling gaps and memories and engaging with the families. And as we talked about, explaining in plain language. I'm now going to hand over to Gillian, who's going to talk about the why and why do we think about using these, and are there things that we need to consider as well?
Right. Thank you, Fiona. So my name's Gillian Colville and I'm based at St George's Hospital in London. In terms of what's the impetus for the interest in diaries, I think we want to help people manage ICU better. We're increasingly aware of the distress that some people report in the long term. And we understand the value of putting a story together. And I think we're also increasingly aware that ICU diaries are being used more often in adult settings. So I think all of that's brought about more interest in this topic. So I want to say a little bit in more general terms about how to help families cope with PICU, come back to the importance of stories, which is important in my sort of day-to-day clinical work in this field, and then evaluate the findings from the adult literature. So next slide. Right, next slide. Next one, yeah. So first of all, just thinking about the population, it's important to acknowledge that PICU patients are mostly under 3. So even if we call this a patient diary, they're not going to be able to read it, apart from the sort of 25% or so that are a bit older. So that's an important issue to grapple with. Also, a lot of them are ex-prems, so as many as 50%, actually, if we just look at the next slide. some recent work, next slide, has shown that although only 5% of children on an NNU end up on PICU, when you look at the proportions on PICU, 50% of them were on an NNU. So we're often looking after families that have spent a lot of time in hospital, including time on NNU. Next slide. And another aspect, just thinking about our population, is that increasingly these are children with chronic complex conditions who may visit several times. And that has implications if you're thinking about diaries. Do you do a diary every time they come in, or think in the way of a sort of hospital passport that some hospitals use? Right, next slide. And I think there's quite a lot of literature coming out at the moment about how different the experience of families of children with chronic problems is to that of families with acute children with acute problems. And this paper came out recently in PCCM, Walking a Tightrope, arguing that we maybe have to think more about continuity of care in ICU when the population is starting to visit us repeatedly rather than just coming in for a one-off, which was more the case in the past. The other point to make, and I like this diagram, it's actually from a psychologist, Anne Kazak, who's based in Children's Hospital Philadelphia, and she put together this model to illustrate the breakdown of the extent of distress in the population of parents she was seeing, and they were from families of children who'd had a new cancer diagnosis. And what's important about this pyramid is the point that most people fall into the green category or the orange category, which is to say most people, even with a very frightening, difficult admission into hospital, recover and psychologically and are resilient, and that applies to parents and children. And the research I've done has shown that about 50% of children and families, parents, never have a PTSD score above the cutoff, even when they're followed up for a year after PICU. So we shouldn't over exaggerate the distress that the families are in, but there is a group of families, and these are the families in the blue top of the pyramid, that are more distressed, and they tend to be the ones that I see when they're admitted. Whereas you see, if you're a nurse or a doctor working on PICU, you see everybody. And I think when we're thinking about diaries, we need to think about, can we justify spending the time doing a diary for everybody, or should we be finding ways to screen for those who might be most likely to benefit from it? So that's just something for you to be mulling over. Next slide. One approach I think is very useful to considering the whole population of children and families on ICU is that of psychological first aid. It's a term that was first invented in the 50s, but recent research has brought it back into, given it a new currency, new slide, and has demonstrated that the way somebody's handled acutely after a difficult traumatic experience, whether that's a hurricane or a mass shooting or a earthquake, that the World Health Organization have put together some useful slides on what it is about the way somebody's handled acutely in a traumatic situation that leads to a better outcome psychologically in the long run. Next slide. And basically, the research shows that people do better in the long run if they feel safe, feel connected to others, are helped to feel calm and hopeful, have access to social, physical, and emotional support, and are helped to regain a sense of control over things. New slide. So, keeping people calm is something. It's not easy to keep calm in an intensive care setting, but I think the bedside nurse particularly can influence how people are feeling because of the amount of time they have with families. Next slide. People need to get some control over a situation. Often they've come in a very short time and are very shaken by the circumstances leading up to the admission. And as we get to know them on the unit, we find ways to help promote their coping. For some people, that might be helping them to make lists or write things down to ask the doctor. Next slide. But primarily, it's about giving them useful information. And I mean, staff on ICU are doing this all the time, but I think they don't think of it as a psychological first aid, but it is actually, you're helping people negotiate the system and understand what's going on. And there are lots of types of information that you need to impart to families. And some of these are more psychological, actually. I think it's useful for them to hear how other people cope and to be aware that of other sorts of reactions that people have. And they often ask about long-term impact on the child and often ask for guidance as to how to tell the siblings what's happened. And again, it's the bedside staff that most often are having these conversations, although as a psychologist, I would also be talking in more detail about these issues, but I only, as I said earlier, I'd only ever see about 10% of our admissions. PICU specific information is also useful to families to understand about the impact of edema, which can really change a child's appearance, and to warn them about the possibility of delirium, which can be very frightening to experience from the parent's point of view. And also obviously information on what happens next when they're discharged from the unit. Next slide. So the next 3 or 4 slides just give you some information on leaflets that are free to download from my research website and from 2 other websites that I think it's worth looking at. So these are leaflets about children's memories and about reactions to trauma. This is an American website. And ICU Steps produce a useful booklet and information sheet about handling siblings. So the importance of stories, and this is important to me in my kind of day-to-day clinical work. There's a lot of psychological theory that supports the need that we have as human beings to put words to what's happened to us. And there's a lot of experimental research that shows that when people can write down or express verbally what's happened to them, they feel less anxiety and less distress. And this aspect of processing information is key to the treatment of PTSD. And I do, in my clinical work, I sometimes see parents, usually more often than children, with PTSD who then embark on therapy such as narrative exposure therapy, which helps them put the story together when they're ready to do that, often some months after the admission. Next slide. In the ICU literature, there are a number of predominantly qualitative accounts illustrating how important the ICU story is to adult patients. State and Williams have written interestingly about this as a kind of key theme. And Davidson talks about the importance of helping people make sense of what's happening to them. Ellie Atkins, who worked with me at St. George's for a while, has written a couple of papers on how parents get through that first year and put their story together, and the story side of it is very important to them. Clinically, we make books when a child's been through a lot. This was a particular child who'd broken his leg in a road accident, but his parents had been much more seriously injured, and his brother. Sometimes we'll use little figures to explain things to children and make books for them to help them understand what happened. So these are individualized storybooks. And I think in my mind, that's a kind of diary, but directed at the child rather than the parents. The Scottish Trauma Network also now do this with their pediatric patients and make books, individual books, to help them understand what happened in their accident. Next slide. More generally, I often encourage parents to write down what's bothering them or what they're worrying about at home but can't deal with at the moment, or questions they have for the doctor. And quite often I'll get buy a notepad to give to a parent who just wants to stay on the unit and doesn't know their way around the local area. It doesn't suit everybody, but there are definitely some people who really feel much better if they just get it down on paper, and then they don't have to try and remember what is, after all, an awful lot of information in a very short period at a time when they're very anxious. In terms of treating PTSD, I use narrative exposure therapy, which involves 6 to 10 sessions with a parent and goes through the experience in much more detail, but does involve putting their story together. Next slide. And I've written that up as a case series and demonstrated that it has sort of meaningful and lasting impacts on PTSD, depression and anxiety in parents of children on ICU. So next slide. So now weighing up the adult literature, next slide. So the question I want to ask of the literature is quite a hard-nosed sort of scientific question. Does using the diary prevent long-term distress? Because that's really the implication of the papers. And as Fiona said, there's a very, very small literature on PICU. And I think even if a lot of people take this up and start researching it, there's a problem in that there are many fewer pediatric intensive care patients than there are adult intensive care patients. And the adult intensive care literature has been growing for a much longer time. So I think it's important we look at the adult literature so we don't make the same mistakes or fall into the same traps. And the literature has been growing for long enough now that there are actually a number of systematic reviews and meta-analyses that we can look at since 2014. And I think, I mean, this is quite a busy slide, but I've put it up in case people want to go back and look up particular studies. But basically, I think what might surprise people is that although adult units are often using diaries, the evidence base is quite weak. So, and in fact, the two biggest randomized control trials didn't find a clear difference in terms of PTSD score at 3 months after admission. And so there's a sort of mixed bag of findings when people try to pool results from lots of different studies. One thing that does emerge, and which is why I've put it in bold, though, is that there seems to be more evidence for relatives. So that's relevant to us because so many of our patients are too young to read a diary themselves. So, I mean, it may be that there is a role for this kind of intervention for parents. But at the moment, strictly speaking, there isn't a clear evidence in terms of patients. And then, so there is this ironic point that we're talking about a patient diary, but the patient doesn't write it. There's quite a lot of debate in the adult literature about who should write it, and can the relatives, if it benefits the relatives, is it still worth going ahead? And what if it benefits the relatives but it doesn't benefit the patient? There's lots of interesting questions to be asked, really. But certainly, normally, as a psychologist, I would need to point out that you wouldn't expect a one-off intervention to treat PTSD, that once somebody's developed full-blown PTSD, they usually need a number of sessions to deal with that. Another problem with the literature is there's inconsistency around the format of diaries. And there's some evidence in qualitative studies that some of the patients are distressed by what they read that the relatives have written. So that's something to think about. And also, not everybody wants a diary. That doesn't mean that they're not useful to the people that do want them, but there are issues around consent. If somebody has, if a relative consents to the diary on behalf of the patient, and then the patient doesn't really want one when they wake up. I mean, that those are sort of interesting issues. I think what came out in the word cloud was this issue of staff time and expertise, and we know particularly in nursing there are very serious staff shortages, and I'm sure Enza will talk a bit about that as a barrier to rolling this out more widely, that ICU nurses have a lot of things to do besides writing in diaries. And I think the biggest question I want to leave with you is, who is this diary for? So I think there's one more slide, Fiona. There's a couple of interesting editorials thinking about is this for the relatives? We're calling it a patient diary. When this is my last slide, when we go back to that pyramid, do we think everybody needs one? How do we justify nurses' time if we can't show from the adult literature that it makes an impact on patients? Or do we work a bit harder on targeting this at parents, given that so many of the children on ICU are so very young? So over to Enza now on how to try implementing this intervention.
Thank you so much, Gillian, and good evening, everyone. It is a pleasure to be here, and I will talk about the implementation strategies on the PICU diaries. But why it is necessary to talk about strategies? It may seem that implementing and using the PICU diary is simple. Instead, implementing the diary is not easy at all. Already, the experiences described in the adult intensive therapies, as said by Gillian, have told us that the implementation of the diary is very complex. In fact, at a superficial look, the use of the diary may seem easy. At a closer look, we realize that the ICU diary is a tool that requires careful and deep study. But let's go in order and okay, thank you. First, the PICU diary is a complex tool for healthcare professionals. In fact, healthcare workers have to face the reality of intensive care that is chaotic and characterized by very frenetic rhythms, so there isn't time. The continuous urgency and emergency of the routine activities compromise the implementation of new tools, especially if the tools are not shared with healthcare workers and are imposed by the walls of the ward. In addition, writing the PICU diary requires privacy and space, a quiet space in which healthcare workers can collect ideas. A silent space that allows the healthcare workers' concentration, away from the chaos of the department, from the pumps, the sound, from the phones that ring, and to be able to dedicate 1 or 2 minutes to leave a thorough memory and a sentence in the diary. And it is very difficult in a chaotic PICU time. Moreover, we should not underestimate the emotional commitment that writing requires. In fact, not all people and not all healthcare workers are expected to engage their emotion and engage in much more intimate communication with the patient or with the family. And they are not ready to share their emotion also with the colleagues. Next slide, please. Thank you. Second, the diary is complex also for families. But why? So in our experience at Bambino Gesù Hospital, during my PhD time, we understand that many elements can not help the compliance of the family members in writing the diaries. First of all, a bad prognosis. Because a bad prognosis often accompanies the fear of memory. So family members don't write because they are afraid of losing their child, their son. they can therefore adopt an attitude of avoidance, and they can choose to not write because they don't want memories of this difficult moment. Another element that can't help writing on the PICU diary is the presence of a child with chronic condition. In fact, a child with chronic pathology, a chronic disease, have sometimes long hospitalization. So parents experience hospitalization not as a break from routine, but a necessary passage of the disease. On contrary, often parents of chronic children feel safer in hospital, so the hospital is not traumatic, and for this reason they chose to do not write on the PICU diary. In these cases, so parents may be not collaborative in writing. And as with healthcare workers, it can be difficult for parents to share emotion by writing, in particular because the PICU diary is shared with other family members or with healthcare workers. In our interview, parents show that have difficulty in communicate by writing. On the contrary, they prefer verbal or physical form of communication. In particular, if communication is direct to the child, they prefer physical communication. Next slide, please. Okay. At the end, we cannot forget that the use of diary is also an organizational challenge. In fact, from the literature, it emerged that the fear of legal problems can hinder the implementation of the diary. In fact, organizations may fear that there may be gaps in the information given by healthcare workers to parents, and therefore there may be discrepancies, difference between what the staff write in the medical record and what they communicate to the family in the PICU diary. So, at the heart of all that we have said just now, the fundamental element is the lack of standardized guidelines. No guidelines and shared guidelines validated by all staff that can guide the organization during the implementation time. And on the other hand, guidelines can support healthcare workers and family members in writing. Next slide, please. So let's go to outline some of the strategies that can guide and improve the implementation of the PICU diary. First, using informed and silent consent form for family. In this way, we can limit the fear of legal problems. In addition, clear guidelines, no. Come back, please. Okay, thank you. In addition, clear guidance guidelines on what is correct to write and what absolutely should not be written in the PICU diaries is important to reduce healthcare workers' fear. Okay, next one. Okay, thank you. Likewise, it is important to know how to write in the PICU diary, taking into account who owns the diary. As said Gillian, we need to understand if we are writing for healthcare workers, for families, or for child. If we think that reading the diary can be useful to the child, we must use a simple and clear language adapted to the age and cognitive development phase in which the child is. Next slide, please. Analyzing the issue on a much more practical level, adult literature suggests that it is fundamental the presence in the world of a healthcare worker with a PICU diary or an ICU diary champion. Who is the champion? He is an healthcare worker who encourages colleagues and family members to write. He write first and collect doubts and problems intercepted during the implementation. For example, champion can help to understand when start to write, when propose the PICU diaries to the family, and understand what and how write in the PICU diaries, adapting strategies to the family. This process will be useful in the debriefing phases when healthcare workers have to meet the research group and support implementation, because it's important to have a research group to support implementation period, implementation time, and report all the barriers to the research team. The last slide, I think that is the most important message, because I won't say you that it is, I believe that it is fundamental to be an early and continuing staff engagement on PICU implementation, PICU diary implementation. It is important to understand the problem of healthcare workers. It's important to listen healthcare workers, because in this way we can really do an implementation right and successful. Thank you. Come back, Fiona.
So just to bring this together, we wanted to talk about a study that I've undertaken called the Update Study, which is the usefulness of PICU diaries in the intensive care setting. I interviewed 11 families and children patients where I could during PICU admission, and then followed them up 6 months post-discharge. But also it's really important that, as Enza has just said, to listen to the experiences of the nurses, and that was the nurses and non-registered nursing assistants working both in the PICU and also on the children's ward, as I recognise that the diaries may start in PICU, but they would be either continue in the non-critical care setting, or certainly be in those settings, whether they're being used or not. And I used a grounded theory approach. I think it's really important that, particularly after listening to Gillian's talk, is that, and we think about the word cloud, is that the use of the PICU diaries are not necessarily implemented or used to either reduce PTSD or reduce depression. And it's really important that we actually do consider what is the use of the diaries, and maybe not set them up as an intervention for those particular conditions. And that's the emphasis that our adult literature has taken. And maybe we've been asking some of the wrong questions. So I'm going to show you the theoretical model that I've come up with the participants. Please don't share this, because although I've submitted my PhD, my viva is in about 6 weeks' time. So there may be corrections that I need to make from this model. But I just wanted to illustrate how parents and healthcare professionals told me that they used the diary. So if we start at this arm, and it was parents in the end that I spoke to, although I spoke to some children, there was only a very small number, and that leaves a gap for future research. But parents told me that the diary was used to create connections between their child, the nurses, and others, and that may be other family members, that the diaries had an emotional impact on them, and they created a huge attachment to those diaries, and was seeking ownership of them, directed how they would then read them, but also recognised that there was an impact on others, whether that be family members or friends, when they read the diaries. The healthcare professionals also talked about creating connections, and that was their connection with the child and their connection with the family, and how they understood more that was going on with the family by reading the entries of the parents. And also the parents told me about how they understood a bit more about the nurses when they read what the nurses wrote about their child. The diaries impacted emotionally on the nursing teams who were writing in them, and that included the aspects that Enza has just talked about around the guilt of maybe not having the time to complete them, for example, or also the positive feedback that they received when reading the diaries. And some of my colleagues talked about how they use diaries then in their personal life. So, for example, if they had a child or an older family member who was unwell and was hospitalised, that they use that as a opportunity to start diaries for them. But really importantly, the nursing team, both on the PICU and on the children's ward, talked about how they use the diary as a tool to empower parents, giving them some choice. Although it was just a small thing that the parents had choice over, it was another example of how they facilitated that engagement and choice for parents. And the overall final core category that came from this study was around this concept about making sense, and how the diary was used in this setting to help parents understand the journey. It allowed healthcare professionals to explain the journey and created those memories as well. So our next steps within ESPNIC is that we are really looking to produce either a position statement or some guidance, taking on board the aspects that we need to consider, the models that we need to think about using, and the guidance on how to utilise this tool in an informed way. So ESPNIC have pulled together and created a neonatal and PICU diary group, and we're undertaking a systematic approach to review best practice, of which we understand there's very little out there, pulling together the experts in this field and creating a consensus agreement on what good looks like. And therefore, those of you in a position to consider using diaries will have an informed base to start from. So watch this space. So just finally, we wanted to finish just to give you the opportunity, if there was anything else that you wanted to either add or ask, and we can populate this in the chat on Mentimeter. And again, the information that you've already provided to us and shared with us will help support our way forward in the direction that we travel with our position statement. So keep your eye out on what ESPNIC are doing, and we're really grateful for you attending today. So I'll just pause for a few minutes while you're adding in some comments, and hand back over to Julie.
Thanks very much, Fiona, and thank you very much to all the speakers. I think you offered a really broad perspective on the use of diaries. And I think there was one question actually that's come through on the Q&A, which came through quite early on. So I think Enza actually did start to address this, but it was around the issue of litigation and how parents might use this. I'm guessing, just drawing on the expertise on the panel, is this something that has been seen yet? I think this seems to be quite a common concern about litigation. Is it something that's got any evidence behind it? Has it been used in any particular cases that you're aware of?
Shall I start from a UK perspective?
Yeah, that'd be great.
It'd be interesting if Enza from an Italian perspective. So I think there has been one situation, probably about 10 or 11 years ago, when the diary may have been used in a best interest case. And therefore, when we were introducing the diaries at the PICU that I worked at, which is the Evelina London, it was really important to have guidelines around what to write and what not to write. And thinking about our professional responsibilities, ensuring that we don't write anything which isn't factual, but that we use that plain language to be able to explain maybe what's happened. And actually, as situations shift and the diary then becomes the ownership of the parent, which in probably the majority of cases happened, whereas that became less of an issue. But we have to be really mindful, and we're working in different situations than we were working in 10 years ago. We recognise the incidence of conflict and disagreements within a critical care setting in the UK are increasing. So it's really important that you go through that governance, that there is a guidance, that you check with your information governance team what you're doing, and that you are mindful of that scenario. So that's my experience from the UK, and I wonder whether or not Enza's got anything to add to that.
It's the same, because in our experience, healthcare workers ask us more indication on about what is a correct right, and more indication, more rules, because sometimes it's very difficult to understand what is correct, what is right to write in the PICU diaries. What is the difference with the medical record, in particular if it is a new tool? For example, in Italy, the PICU diary wasn't used before, and so it's very, very new. And when we start implementation, one of the problem was what to write. So it's important to do guidelines, written guidelines, to explain that it isn't a medical record or a simple medical record. It is a tool for families or for child, and we need to understand that we have to use simple words. We need to give them reassurance, because family, not in all PICU in Italy, parents can stay with child every day and night. So it is important to give them a continuous line about what is happening to their child.
Thank you, Enza. I think you covered, actually, I was just looking at the comment that's come through on the Mentimeter about the pressure to know what to write. I think you addressed that well. There's a few comments in the chat, actually, about people saying that the issue's been around photos, which is quite interesting. And Rachel from the UK has written about parents writing in them, which wasn't something that was done in Birmingham. I'm quite interested in Gillian's question, the question to Gillian, actually, that I just want to get to before we have to close. But Gillian, was a question from Ursula, actually, about who do you think are the patients that would benefit most from this intervention?
Well, I'm still kind of sitting on the fence in terms of using diaries, but as a clinical psychologist, I've definitely felt that individualized storybooks for some children are really helpful, that they haven't really understood what's happened to them at all, you know, that they may not remember anything for 2 or 3 weeks. And I think working with a family to explain in developmentally appropriate terms what's happened to a child can be really useful. So I think I keep coming back to this question: who are we writing them for? So my interest acutely has been to help the child understand what's happened to them. So I've tried to, although I have done a lot of clinical work with the parents, I do, as a child psychologist, I'm interested in the sense that the child makes of the admission, and that's largely the older children. And I'm thinking probably particularly children that have been through traumatic accidents, but also some that have had quite complex cancer surgery. That I've had on more than one occasion. I've found that giving the book to the parent has then used the book to explain to a relative what happened, and you suddenly realize the parent hadn't really understood what was going on. That sometimes when you write something very simply and straightforwardly that the child can understand, you increase the understanding of the family and of the relatives. And I've also had children read their storybook out in assembly at school to help their classmates understand what happened, or show the book to the teacher. So I'm kind of wanting to raise the idea of making books specially for children, but they take some time to make, and I think they're better books if you know a bit more about what the child is normally interested in, and that takes a few conversations to develop. So that's another variation on a theme, really, but with the patient at the centre.
I think that's a really good point, Gillian, actually, isn't it? Especially given the constraints that we're all working in. I think Enza raised this issue about the busyness of the units and the staff workload. I think clearly this is a topic that's stimulated lots of discussion. So Fiona, first of all, good luck for your Viva. I hope it all goes well. I think your model's really interesting, actually. I really thought it was really interesting, the elements around empowering involvement, which is obviously slightly away from what we think of the diary being about. So I think with that, I'm going to close this session so that we finish on time. I'd like to thank all three of you for speaking today. It's been really interesting to have that really balanced perspective from you all. And thank you to everybody on the call who's joined us. I think hopefully this has met everybody's needs, and it's been a really good way to discuss things, and look forward to more work coming forward from the group on the consensus statement. So thank you very much to everybody for joining us.
Bye.
Thank you. Bye.